Hey colleagues, if you are a mental health professional but feel like you don't have an understanding of the basic medicines that are used to treat common mental illnesses, then listen up, because in this series we're diving deep into psychopharmacology for therapists. Welcome back to Psychopharmacology for Therapists. In this series, we're exploring the most common medications in mental health with added therapist commentary to help mental health providers be more effective in their work. In this episode, we're discussing anxiolytics. Next, we're going to talk about anxiolytics, or medicines designed to help people reduce anxiety. Now, these have lots of different types to them, and one of the interesting things you'll notice about patients who have anxiety is that they are hungry for some kind of treatment. Whereas depressed patients may struggle with accepting the reality of depression and accepting that it's a problem that they can medicate, anxiety people are usually all too happy to get any kind of relief they can because the suffering of anxiety is so profound. Now, just like with depression, as we prepare to talk about anxiety, we should probably talk about the differences that anxiety can have because there's different types of anxiety and different levels of severity. For example, do you know the difference between generalized anxiety disorder and what we call panic disorder, and perhaps the difference between both of those and what we might refer to as a panic attack? So, referring back to the DSM, generalized anxiety disorder is going to have excessive worry and three symptoms like restlessness, feeling keyed up or on the edge, being easily fatigued, difficulty concentrating or their mind going blank, irritability, muscle tension, or sleep disturbance. So, okay, we can sense that they're anxious and it's disruptive to their life for sure, but that's different than what we might call panic disorder. And the DSM defines that as recurrent, unexpected, abrupt surges of intense fear involving at least four of the following: palpitations, pounding heart, accelerated heart rate, sweating, trembling and shaking, sensations of shortness of breath or smothering, feelings of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, chills and heat sensations, paresthesias, which is numbness or tingling sensations, derealization, feelings of unreality that they're detached from what's real, or depersonalization, being detached from themselves, and feeling fear or losing control, like they're going crazy, or feeling fear of dying. So clearly, you can understand that there are different levels of severity between those two experiences. Panic disorder is very physical, it's very abrupt, it just sweeps in, and they can't think their way out of it. Whereas anxiety disorder is something where there's excessive worry, poor thinking, catastrophizing, cognitive distortions. You can learn to think your way out of it. These details are very important when we think about the kinds of medicines we use to treat both of these realities. So let's talk about that first line of defense, benzodiazepines. Now, benzodiazepines are really good for acute panic episodes. Yes, you can use them for panic disorder. Yes, you can use them for anxiety generally and anxiety attacks more specifically. As a general rule, physicians try not to give people these medicines indefinitely because there is some research that shows it can cause long-term memory issues. Now, if somebody's taking benzodiazepines, those benzos will affect them similarly to how alcohol molecules do. So it's a medicine that's contraindicated for people that have a history of drug or alcohol abuse because benzos are a narcotic. So let's play that fun game where we try to say all the words. And almost every single one of these is something you will see in your work. Patients will be prescribed any number of these. So we have classic old alprazolam called Xanax. We have let's try it again. Chlordiazepoxide. That feels right. Or Librium. I always hear it called Librium. And now I know why, because that's a really big word that nobody wants to say. We have clorazepate or Transine. We have diazepam or Valium. You'll hear that one a lot. Halazepam, Paxapam, which I never see. Lorazepam or Ativan. I see that one often. Oxazepam or Serax, never see that one. Prazepam or Centrax, also never see that one. Quazepam or Doral, never see that one. And clonazepam or Klonopin, see that one regularly. Now, under the category of benzodiazepines, we have some that are called atypical benzodiazepines. These are a little bit different because they're usually hypnotics or sedatives. They work really fast, they don't last as long, and they usually put you to sleep. So they're not typically prescribed whenever somebody's trying to function on that medicine, the way some of these other medicines we just talked about are. Side effects are amnesia and even sleepwalking, which we see rarely but has totally happened. So ones that you'll find in this category: Estazolam or Prosom, I've seen people prescribed that. Zolpidem or Ambien, very, very common. Ezopisclone, which is Lunesta, yes, see that one a lot. And Zaloplan or Sonata, very common. Again, usually prescribed as a sleep aid for people that are having anxiety intrude on their ability to go to sleep. Now, you remember this one from the portion of this presentation about antidepressants, buspirone. Now, buspirone is really cool because it doesn't work against the CNS, the central nervous system, which means that while no medicine is ever safe to take with alcohol, this one's a bit on the safer side if you know this person's going to continue drinking. It's also good because it's non-narcotic and non-habit forming, unlike benzos, which are very much both of those things. It has a delayed onset of action. It can take 1 to 2 weeks to take effect. Usually that means a medicine's much gentler, but usually also means that it will last longer and isn't just used for acute episodes, which is one of the things it doesn't do. It's not there to shut down your system very quickly and bring a sedation effect, so it doesn't work with that acute panic attack episode. It does have some side effects like nausea, dizziness, and anxiety. Again, because anxiety and depression are very common, you find patients that do have both, and so it's not uncommon that people are given SSRIs to try to deal with their depression and hopefully assist with their anxiety, and then their antidepressant may be boosted with buspirone to again assist with the anxiety and also augment the antidepressant effect. Next up is, in my opinion, one of the best medicines on the market, antihistamines. Now you might be thinking, Jim, antihistamines, those are allergy medicines. Yes, they are, but they're also used for dealing with anxiety. So what's great about these is they are completely non-narcotic. Yes, they are allergy medicines, but one of the known side effects of antihistamines is that sedation effect that you associate with things like Benadryl. And so it does have the effect of reducing anxiety. And they actually are really effective for acute panic and anxiety attacks, and you don't have to take a narcotic. And they last from 4 to 6 hours, and they usually kick in 15 to 30 minutes. Now, they do have some side effects. Yes, people know what it feels like to be drowsy on Benadryl, so that's a thing. Dry mouth, blurred vision can happen as well. Here are the names of those, and you've probably said them at some point in your life. Now, I pronounce the first one diphenhydramine. I've heard other people make a f sound, so diphenhydramine, but it's just Benadryl. And the most common one you'll see physicians prescribe is hydroxyzine, or Vistaril or Atarax. Now, quick note on Benadryl. Benadryl is an over-the-counter medicine. Your patient can just walk down to their local pharmacy and get one, or their local Walmart and get a whole box of these things. They're very, very gentle, and they're not dangerous. But I still want you to stay in your lane and come back to that understanding that we're here to educate, refer, and monitor. So we don't like to tell patients, hey, you've got anxiety, I recommend going and taking Benadryl. And you might think, oh, I'm well within my rights. I'm not prescribing a medicine. I'm not telling them to go take marijuana or something else that's narcotic. It's just classical Benadryl. You can educate them that Benadryl has been used by some people as an over-the-counter solution, but you do not tell them, I want you to go do this, because now you're giving medicinal advice, which is outside of our scope of practice. Next, let's talk about beta blockers or antihypertensives. So these medicines, very common for anxiety relief: propranolol or Inderal, and atenolol or tenorimin. So these are heart meds. They block norepinephrine receptors. They are not habit forming. They also don't work acutely. They're good overall. They can work within like the span of several hours, but I don't see that being something people should take when they're having a panic attack. Generally, they reduce peripheral anxiety symptoms, so like the sweating, rapid heartbeat, tremor, but not those internal symptoms like you're sitting there imagining that you're going to die or that you're going to be fired, those catastrophic thinking episodes or racing thoughts. Research does show that they're pretty good for performance anxiety because they have that stabilizing physical effect, but they don't necessarily, as we talked about, provide relief for those acute instances of actual panic or anxiety. And then again, side effects, low blood pressure because it is a heart medication designed to decrease blood pressure because people that are taking them are taking it for hypertension relief, and they can slow you down so much that sometimes we see them actually cause depression. Now, here's some more beta blockers that you should be aware of. This next one is near and dear to my heart and the heart of anybody who's ever worked at inpatient rehab, clonidine or Catapres or Capve. So this is also a hypertensive medication, but it's also used to treat opioid withdrawal. And so when you've got all these people that are trying to get healthy off of drugs and they're really sick and not doing well in your rehab, boy, are you happy that this treats them, and it also calms them down, which is really, really helpful because nobody's happy at rehab. So a very effective medicine. It also is used to treat anxiety. What does it do? The same thing. It inhibits that norepinephrine release, and it does have the side effect of sedation. Another one is prazosin or Minipress. This is a high blood pressure medication. It has been used to treat nightmares. It does lower blood pressure, and it can cause that sedation. But with this one, there can be that risk of a dangerously low blood pressure. So that's something that a lot of physicians keep an eye on when they consider prescribing this. So, a couple of things I want you to keep in mind when we talk about anxiety medicine and how to treat folks. First off, those benzodiazepines are usually the first thing that are offered, besides SSRIs, which treat depression but can also have a good anti anxiety effect overall and over time. But benzos are addictive, and they do have withdrawal symptoms when people take them too often and become dependent on them. They're really, really effective for that acute relief of panic, and so they are a legitimate medicine. But just as a therapist, you want to be mindful of this, that it's not something that hopefully people are taking forever. Hopefully the therapy is working, they're starting to get some relief from their symptoms, and they're not dependent on the benzos all the time. Another thing to keep in mind is that whenever you combine anxiolytics, those medicines that we just went over that have to do with treating anxiety, and alcohol, that combination can often be lethal. The way I educate my patients is just reminding them these medicines that you're on, like benzos or antihistamines or any of these, especially the heart medications, the beta blockers, boy, do they not like alcohol. They are not friends with alcohol. It will make you feel way worse and potentially in danger. And so I always try to warn people these medicines do not mix, do not take them and then drink. In this series, we're covering the most common forms of medicine and mental health to help therapists feel confident and familiar with their work. I hope you'll use these videos as a resource for yourself or your colleagues, and I look forward to sharing more with you in the future.